Hello, everybody. I am Dr. Vipul Janardan. I am from Institute of Human Behavior and Allied Sciences, New Delhi. I will be talking about obsessive compulsive disorder. So first, I think everybody has uh, heard about this disorder. So OCD is a complex mental disorder that characterized by recurrent intrusive thoughts, recurrent repetitive intrusive thoughts that causes significant distress to the patient's life and interfere in his daily day-to-day activity. So and this is it has symptoms of obsession as well as the compulsion. So obsession are the thoughts, intrusive thoughts that causing distress, and the behavior, the things that he follows or the repetitive behavior is is a compulsion. So like checking things, like excessively checking things, repeatedly arranging things, that is. So cause of the OCD or obsessive compulsive disorder is not known. There is many factors, multifactorial etiology is there, like complex genetic involvement is there, and genetic history, and there are a lot of things that, and we can say that combination of them that may result in the OCD. So diagnosis of OCD is based on the clinical history of the patient as well as certain serial mental status examination, MSE, that, and certain neurological tests we can diagnose with OCD. The as as far as the management is concerned, treatment is of the OCD is always medication in moderate and severe cases, but in mild cases CBT is recommended in most of the guidelines. And moderate and severe cases, SSRIs like fluoxetine, fluvoxamine, clomipramine are the drugs that can be used. uh, Generally, in these are the drugs that are also used in the depression or anxiety, but in case of OCD these are used in the larger amount or in the greater doses. And most of the patient responded well, but there are certain category of patient who did not respond well, who do not respond to these treatment. So in that cases, medication along with the cognitive behavior therapy, these are the things that can be helpful for the. Along with that, CBT and exposure and response behavioral therapy are the good one that help beneficial in most of the cases. Out of that, there definitely importance of family support and other family therapy is important part of that. And there is always a hope for the researchers, and we are expecting more from that. So that from that I want to conclude this about OCD. uh,
Yeah, can I ask you, so you mentioned anxiety. Is anxiety important, in OCD?
Most of the OCDs patient that we see is also suffer from the depression and anxiety. They concomitantly suffer from the anxiety and depression.
So
So
why?
so the, and moreover the this comes in the anxiety spectrum. So most of the uh, OCD patient also having the anxiety, or they are in the significant distress and they exhibit the symptoms of anxiety.
Yeah, so I'm a doctor myself. So sometimes I see patients who, when they don't, let's say, I think we had patients who would wash their hands
Hmm.
and repeatedly, and sometimes they do that just to avoid the anxiety and the stress, and then they wash, and then when they dry their hands, the anxiety comes back. Have you seen something similar? Can you remember a case or something?
Yeah, generally it happens because they actually the I think hand washing is a compulsive behavior that they think that it will help them to elevate the anxiety. So generally they do it. Most of them, they have a compulsion about these obsessive symptoms they have.
Yeah.
Mm.
So I can remember a case of who was living in Australia, and she had everything to do in prime numbers. So, so let's say in that way, when she went up the stairs, she had to go one, then two, then going down three, then five, then seven, and so on. Is that
Mhm.
something common which in India, so that these ruminations about prime numbers are important, or have you seen cases?
Yeah, yeah. I think they have obsession about this number, and like this is one of the common type of OCD. Pathological doubts, apart from the contamination and the pathological doubt, and this is about symmetry. Obsession about the symmetry is quite common in few of the cases.
Yeah.
As yeah,
So
I think main is.
what's the problems then? So if the people wash their hands, so does it affect their life? And how would OCD affect the patient's life? Can you give an example?
Yeah, it affects the life. In first of all, it causes the distress to the patient, and second thing is like it causes distress to the caregiver, and it causes significant distress to the caregiver. And there are always a dermatological manifestation like excoriation of the skin that's seen with a lot of people who are having OCDs. So all the skin get like excoriated. So it also like later on causes the physical distress also in physical in the form of this type of thing. And they are more prone to the, since skin is affected, they are more prone to the like infections and other things. So I think this.
What other OCD, obsessive compulsive disorder, can you remember with your patients, so
I have seen like lot of people having contamination, and other have seen like about pathological doubts. So they always like keep on checking the locks, and they keep on checking the locks, or they keep on checking the like stove. The so it was causing the significant distress, and they spend around 1 to 2 hours of time. So it hamperings them their day-to-day activity, and it is difficult for them to do their studies. He was a student, so it was difficult for him to do his studies, and it was difficult for him to do his like day-to-day activity. So it was causing a significant distress.
okay. Yeah, thanks a lot, thanks a lot from the UK here.